Hi, this is Rachel from Lively Rachel Ann, and today I am bringing you some information regarding 7 questions for the nursing clinical team. So these are questions that you're going to want to ask before starting your first job, and it kind of discusses things about the entire team and everything that kind of goes along with that. Now, this information is also based from a book that I received, and if you've seen previous videos to this one, you'll know what book I'm talking about. It's called The First Year Nurse, Wisdom Warnings and What I Wish I'd Known My First 100 Days on the Job. And this is from Barbara Arnoldussen. Question number 1, how many other nurses work in that capacity, and are some of them recent grads? So basically what you're going to be wanting to know is how many nurses work on the floor that you'll be working on or in the office that you'll be working in, and how many of them are recent grads. So are they taking a lot of new grads? If so, why or why not? And how does that process work? Question 2, are there any choices about shift length or start time? So when I first started my nursing job, the option was to work 36 hours per week. That is the job that I agreed to. Those I could have chosen either 12-hour shifts or 8-hour shifts. So 3 12-hour days or 4 8-hour days. Kind of just depended on what my preference was. And then the shift, for me, I was hired as a variable shift. So basically I just worked whenever they wanted me to. So days, PMs, overnights, it just depended on the need and where I could fit into the schedule. Question 3, at what point do you pay overtime or shift differential? So for us, anything above and beyond the 36 hours was considered overtime. And then after that, we also were given shift differential pay. So we had our base salary rate during our daytime shift. And then we had, I think, an extra $1.50 per hour for our PM shifts. And then for overnight shift, I believe it was an extra $2 per hour. And possibly weekends were an extra $2 per hour. I think. I could totally be wrong about all of that. It might have been 50 cents to $1.50 extra per hour. It kind of just depends on the facility and what you're willing to agree to. Question 4, would I be required to rotate different shifts, or would I be required to float to different floors? So again, that kind of goes with what you agreed to. Some people, when they first start off, are looking for just straight day shifts, and that's not always common for a new nurse or new grad nurse. So you kind of just agree to whatever they have in mind. Most times they try to do a fair shift, a fair schedule for you so that you're not working night and day, but you're pretty much going to be split up between nights and days, and you just kind of have to make sure that you're not double backing and coming right back after you just finished a night shift. And then in the unit that I worked on, yes, there was the possibility that if our unit was slow or the capacity or volume of patients were low, then we were expected to go to other parts of the hospital that would be needed before they would consider us low census and send us home for the shift. Question 5. Will I be on call? If so, how often? So this question is really tricky because in the unit that I worked on, yes, we did have call hours, and we were expected to pick up anywhere from 24 to 28 hours for every 6-week rotation. And so basically those are hours that you choose. There's a listing of hours that gets released to the department, and other nurses can kind of go and pick up the shifts that work with their schedule. And so sometimes if you are scheduled to work a 12-hour shift, you may pick up call hours 4 hours before or after your 12-hour shift, so that since you're already going to be there, then it's just working an extra 4 hours. And so other people just wanted to schedule a full 12-hour block of on-call hours on a day that they weren't scheduled to work, so that way they could try to get a lot of it out of the way in one day. So you really have to be careful when you agree to working 36 hours per week. Always find out if there's on-call hours that you're expected to work. At least 50% of the time I was called in on my on-call hours. So just know that those are extra hours in your week that you get paid for. So lots of different pay scales, lots of different pay rates. Make sure you're aware of all of them before you agree to your first job. Ooh, call coming in. Question 6. Are there opportunities for increased responsibility later on for that position? So for me, in my experience, there definitely was opportunity for increased responsibilities. There was lots of different boards that you could be on. So just different things that were available in the actual department that you worked on. And for the hospital, like hospital-wide, there are different boards that they would like people to kind of join in and be a part of. Also, you could be needing to be certified in different areas specifically for your job. So for the job that I worked on the birth center, I needed to be NRP certified, so neonatal resuscitation program certified. So basically like life support, not just for adults, but also for neonates. So those are things that you have to be aware of and do take time also out of your day in your free time to do those things. So just be aware that when you make it a commitment like that, that's something that you truly do want to do and that you can uphold the responsibilities for that. Question number 7, last question. So what is the nursing ratio for patients to nurses? So this is a really important question because it kind of also depends on the shift, depends on whether it's day shift or night shift. I've seen sometimes nurses during the day shift on a regular med surgical floor can have anywhere from 4 to 8 patients each per nurse. And then overnight, it just increases from there. If you feel as though your assignment of having too many patients is too much, then make sure you speak up to your shift leader, your shift nurse, and let them know if it's something that you don't feel comfortable with. And could you also give a patient or 2 to someone else if you feel like you can't handle that. Okay, these are the 7 questions that you should be asking before you start your first job for the clinical team. If you have any other questions that I didn't touch on and that you do want answers for, or you think should be included in a future video, make sure you put them down below in that comment box and I'll make sure to add them. Thank you for watching. We'll see you next time. Please like this video and subscribe if you think it's something that you could give to someone else or someone else could benefit from this video. Please share it with them. You guys have a good day. Bye-bye.